So for my hip eval on this week, I did it on a mock patient since I wasn't able to get a real patient with a hip problem. So I realized a mock patient with it. The scenario that they gave me was a football player that was limping while walking. He was having pain on the left side of the hip, especially more on the superficial area. He was having problem walking, especially having long walks, and during those long walks, every time was getting worse. Um, he was also bothering him through this going up and down the stairs. He wasn't able to run at all. Um, my evaluation was comprehensive. I feel like it was because I was able to get all that information so I can see what is a little bit what is gonna be happening uh, about it. Also, for my palpations, the inspection and the objective measurements, if they led me to a confident diagnosis, they kind they kind of did because I was close in the area of what was happening exactly. So the palpations I did was to palpate the ASIS, the AIIS. I also palpated the quad tendons, the muscle body of the quad, see if there's some tightness in the area over there. I did some range of motion also for flexion, extension, abduction, adduction, internal rotation, and external rotation. Besides that, I realized some manual muscle testing, which all of them gave me a grade of 5 out of 5, except when it was for flexion, hip flexion. That was a 3 out of 5. He wasn't able to do it on that scenario. Um, that was the evidence that I incorporated into my evaluation. Also I did some special tests that it was Ellis test, Thomas test, and Genselin's test. I did those three in order to realize what was happening on the area. I feel like I did well when it was for the range of motion and manual muscle testing, um, and getting some of the information needed for so I can be able to improve that, and also like know what is gonna be happening with the patient, what is happening actually. Um, the areas that I can be able to improve will be more of like recognizing the type of injury, because after I did the special test, my diagnosis was uh, tightness in the iliopsoas, when the scenario was the patient was having uh, quad tendonitis in the distal portion of the quads. So that's why he was having more problem doing hip flexion. Um, but I thought it was gonna be iliopsoas, since the iliopsoas mainly focus also for the hip flexions. So is gonna be more of like realizing which diagnosis and do any other special tests if needed, so I can be able to go more in depth with the actual diagnosis and with the correct diagnosis.